Well, my name is Matt. I'm Professor Owen's clinical class, Adult Health 1. We're going to start an IV insertion. I'm going to start by checking the orders. The patient needs to get electrolytes. He's got electrolyte imbalance. We're going to infuse some fluids into him. Have to start an IV. The order says that he needs a 20 gauge, which I have. I'm just going to ask if the patient has any pain or any allergies that he's aware of. He doesn't have any allergies that he knows of. So I'm just kind of palpating the arm to see if there's any pain in the site that I'm going to use. I'm going to use the most distal site that I can on the non-dominant hand so I don't affect any of his activities of daily living. So I'm going to begin by drawing up my 3 mLs of saline. So I'm just going to wipe this bottle off here. And draw up 3 mLs. Alright. I'm going to inject 3 mLs of air. Then turn it to draw back. 3 mL. That was good. That was funny. Alright. I'm going to scoop this. Take this off, put it in my sharps container. I'm going to go ahead and prime my line here. Alright, unclamped. Go ahead and prime it. I'm going to clamp this back. Leave it there. Alright. I'm going to fold my hands here. Place this tourniquet. I want it 4 to 6 inches above where I'm going to insert the IV. Alright. I'm going to wash my hands again. I'm going to put my gloves on. Alright, again, my 20 gauge needle, I'll just double check. Make sure. I'm going to go ahead and wipe my insertion site. Alcohol. Right here is a good vein. Alright. I'm going to go in with the bevel up at a 15 degree angle. I'm pulling the skin taut here. I'm going to warn the patient there's going to be a big stick here as I put this in. So I put that in. I can see flashback in my chamber here, so I'm going to advance the catheter while pulling the needle out. Keep pressure on that. This IV is going to go into the sharps container. I'm going to get my line over here ready. Screw that on the catheter. I'm going to aspirate to check for blood return. Have blood return. I'm going to uncap that, aspirate for blood return, have blood return, so I'm going to flush the IV. Flush as well. Patient states there is no pain. I'm going to make sure with a gauze that it's all dried around the site. And then I'm going to put a tegaderm on. And I'm going to write my date on here, my initials, and the gauge that we're using. And I'm going to tape it down just to secure it, to make sure that it's not going to go anywhere. Flip this back, tape it down. I'm going to clamp the IV tubing. I'm going to remove my saline flush. And that's it. I'm going to put in the computer what gauge I put in, time, if the patient tolerated it well, and that's it. Thank you.
Okay, I think it's paused.